Very good morning, students. Today we are going to discuss about the second session, that is about the metabolism of alcohol. Now, alcohol is metabolized in liver, means more than 90% will oxidized in liver, first by alcohol dehydrogenase to acetaldehyde and then by aldehyde dehydrogenase to acetate. So about 25% of acetaldehyde is metabolized extrahepatically. So you see here, ethyl alcohol get converted to acetaldehyde and acetaldehyde get converted to acetate, and here you see oxygen plus water from acetate. During this process, alcoholic dehydrogenase and aldehyde dehydrogenase is utilized. Now, the metabolism of alcohol follows zero order kinetics. A constant amount is metabolized per unit time. For an example, about 10 ml absolute alcohol is metabolized per hour. It is excreted through kidney and lungs. Small amount of ethanol are excreted in urine and expired air. Hepatic metabolism shows saturation kinetics mainly because of limited availability of NAD+. Maximal rate ethanol metabolism is about 10 ml per hour. Here you see ethanol C2H5OH get converted to alcoholic dehydrogenase into acetaldehyde CH3CHO, which get converted to acetic acid CH3COH, and in the presence of acetyl coenzyme A, it will get converted into carbon dioxide, water, and energy in the form of ATP is released. The two enzymes microsomal oxidase NADPH and catalase H2O2 are required during this process. Thus, the plasma concentration fall linearly rather than exponentially. Acetaldehyde may produce toxic effect. Inhibition of acetaldehyde dehydrogenase by disulfiram accentuate nausea, discomfort, etc. that is caused by acetaldehyde and can be used in the aversion therapy. Methanol is similarly metabolized to formic acid, which is toxic, especially to retina, and may cause retinopathy. Asian races show a high rate of genetic polymorphism of alcohol and aldehyde dehydrogenase associated with alcoholism and alcohol intolerance, respectively. Here you see mechanism of action of alcohol. So alcohol is a amphophilic. For example, it is both hydrophilic and lipophilic and therefore can dissolve in natural plasma membrane. The mechanism is equivalent to many volatile anesthetic agents, i.e., produce membrane fluidizing effect, and therefore it hampers the movement of sodium and calcium, while movement of chloride ion, specifically stimulation by gamma aminobutyric acid, is increased. Now, regarding actions, first local action. On topical application, ethanol means ethyl alcohol evaporates quickly and has a very cooling effect. It is an astringent, that is precipitate surface protein and harden the skin. 40 to 50% alcohol is rubefacient and counter irritant. Alcohol is also an antiseptic. At 70% it has maximum antiseptic properties, which means it kills more than 90% surface bacteria, which decreases about it. It is not effective against spores. Isopropyl alcohol is 60 to 70% more effective. Injection around the nerve causes neuritis followed by nerve damage. CNS effect. Alcohol is a CNS depressant. Small doses causes euphoria, relief of anxiety and loss of social inhibitions. Moderate doses impair muscle coordination and visual acuity, making driving dangerous. With higher doses, mental clouding, impaired judgment, drowsiness, and the loss of self control results. High doses cause stupor and coma. Death is due to respiratory depression. Alcohol may precipitate convulsions in epileptics. Tolerance develops as long term use. Chronic ingestion results into neurological disorders. For example, Wernicke's encephalopathy, and it occurs because of vitamin B1 deficiency, that is a mental confusion, ataxia, polyneuropathy, etc. Then Korsakoff's psychosis, that is learning and memory disability, sleep disorder. If CNS, there occurs increase in GABA aminobutyric acid mediated inhibition, similar to the action of benzodiazepine. Inhibition of calcium entry through voltage gated calcium channels, inhibition of NMDA receptor functions. Effect on cardiovascular system. The action are dose dependent. Small doses causes cutaneous vasodilation resulting in flushing and feeling of warmth. Large means moderate doses causes rise in HDL, that is high density lipoprotein level, and depression of myocardium means fall in the contractility of the heart. Intake in higher means chronic dose causes development of CCF, congestive cardiac failure, or other cardiomyopathy, hypertension, and arrhythmia, in which it may lead to death sometimes. GIT and liver. Alcohol is an irritant, produces gastritis, increased gastric acid secretion, and produces vasodilation and warmth. It causes deficiency of water-soluble vitamins and may induces pancreatitis. It is an appetizer in a small amount. Chronic consumption of moderate amount of alcohol results in peptic ulcers, hepatitis, then accumulation of fat in the liver, liver enlargement followed by fatty degeneration and cirrhosis. Then alcohol also decreases microsomal enzymes. It may causes alcoholic cirrhosis. Then endocrine functions or actions. Though alcohol is called an aphrodisiac, increased aggressive sex behavior, this effect could be due to loss of inhibition, means inhibition of control, and ultimately it causes testicular atrophy and gynecomastia. Impotence and sterility on long term consumption. Musculoskeletal action. It impairs psychomotor performance and blunt the relaxed motor activity, that is muscle relaxation. Even previously used as an uterine relaxant in premature labor. In pregnant female, it crosses placenta easily. It produces testosterone, teratogenic effect called fetal alcohol syndrome, which is characterized by microcephaly, deficient growth, intrauterine growth retardation, short palpable fissure, wide eyes, small cheekbone, mental retardation, hyperactivity in the presence of anatomical abnormalities. Other effects: low dose taken over a long period of time increases HDL and lower LDL cholesterol. Alcohol is a diuretic, means it reduces ADH secretion. It interferes with folic metabolism and may cause megaloblastic anemia. Though it causes a feeling of warmth, heat loss is increased due to vasodilatation and should not be used for warming up in cold surroundings. Food value is 7 calories per gram. It may stimulate respiration. Now, various uses or indications of alcohol. Number one, sponging on the body surface for decreasing body temperature. Then it acts as an antiseptic or disinfectant. It if 70% alcohol is applied topically, then only it acts like antiseptic. Bed sores, which is also called decubitus ulcer, when rubbed into the skin, alcohol hardens the skin and prevent bed sores. And anhydrotic lotion to reduce sweating. Appropriate stimulation, about 50 ml of 6 to 10% alcohol given before meal is an appetite stimulant or work like appetite stimulant. Neuralgias, in severe neuralgias like trigeminal neuralgia, injection of alcohol around the nerve causes permanent loss of transmission and relieves pain. Then, as an solvent of vehicle for injecting medicinal mixture. Then Bramhaptone mixture, it is the mixture of alcohol, opioid, and or phenothiazines used sometimes to relieve pain of terminal illness. In methanol or ethyl glycol poisoning, it is also used rarely to treat premature labor. Its 10% solution suppresses the ultimate contraction by reducing the release of oxytocin. Drug interaction, alcohol potentiate other CNS depressant including hypnotics, opioids, antipsychotics, etc. Sulfonylurea, chlorpropamide, metronidazole, griseofulvine, and certain cephalosporin have disulfide-like reaction, which uh, disulfide-like reactions on alcoholic consumption. Alcohol is an enzyme inducer. Alcohol with non-steroidal anti-inflammatory drugs uh, causes more GIT bleeding. When you administer alcohol with insulin or sulfonylurea, then hypoglycemia may develop. Acute alcoholic intoxication, it causes severe gastritis, hypotension, hypoglycemia, hypothermia, disturbed sensorial and hypostatic pneumonia, increased intracranial pressure, respiratory depression, coma, and death. Treatment measures includes gastric lavage, airway maintenance, positive pressure, ventilation, and maintenance of fluid and electrolyte balance. Maintenance of blood pressure, temperature, and hemodialysis is needed in severe intoxication. Adverse administration of hypertonic mannitol IV, then phenothiazine, butyrophenone is administered to control psychotic behavior. Then analeptics are not recommended. They may produce convulsions. So chronic alcoholism causes both tolerance and dependence and are due to increased metabolism and neuronal receptor adaptation. Then withdrawal symptoms, stage 1, nausea, vomiting, sweating, tremor, and hyperactivity. Stage 2, auditory and visual hallucination. Stage 3, delirium, tremors, confusion, disorientation, autonomic hyperactivity, and other systemic toxicity. And later on, Wernicke's encephalopathy, Korsakoff psychosis, tremor, cirrhosis of liver, and along with this, hypertension and cardiomyopathy can occur. In addition, nutritional deficiencies such as polyneuritis, anemia, and pellagra can occur in pregnant women. Alcohol is teratogenic. Even moderate drinking during pregnancy can produce fetal alcoholic syndrome with manifestations like low IQ in the fetus, microcephaly, growth retardation, and facial anomalies. It can also cause stillbirths and abortion. Treatment: multivitamin tablet capsules, especially vitamin B6, treatment of acidosis, benzodiazepine for suppressing withdrawal symptoms using disulfiram. It is discussed below using naltrexone, that is an opioid antagonist. It reduces alcoholic consumption and craving probability by inhibiting dopaminergic pathway in the brain, which is critical for reward phenomenon. Diazin, it is a Chinese herbal medicine and is a specific inhibitor of ALDH1. Then nalmefene, it has better oral bioavailability, less hepatotoxicity, and longer duration of action as compared to naltrexone. Then using a composite it GABA analog and NMDA antagonist, it reduces neuronal hyperexcitability and inhibit alcoholic craving. Using fluoxetine psychiatric counseling for complete abstinence from alcohol, then in supportive management, including symptomatic treatment, treatment with beta blocker, clonidine, etc. Disulfiram. Disulfiram inhibits the enzyme aldehyde dehydrogenase. If alcohol is consumed after taking disulfiram, acetaldehyde accumulates and within few minutes it can produce flushing, throbbing headache, nausea, vomiting, sweating, and hypotension and confusion, called the end abuse reaction due to accumulation of aldehyde in the brain. The effect lasts for 7 to 14 days after stopping disulfiram. The reaction can sometimes be very severe and therefore treatment should be given in hospital. The drugs that cause end-abuse reaction are metronidazole, chlorpropamide, tolbutamide, griseofulvine, cephalosporin, and phenylbutazone. Contraindications are patient with liver diseases, then patient with physically dependent on alcohol. The second part or the second compound after ethyl alcohol is methyl alcohol, which is also called methanol or wood alcohol. Methanol is used to denature ethyl alcohol, then ingestion result in methanol poisoning. In the presence of alcoholic dehydrogenase, methanol get converted to formaldehyde, and in the presence of aldehyde dehydrogenase, it will get converted to formic acid. So final end product is formic acid. Toxic effects are due to formic acid. Manifestations are vomiting, headache, vertigo, severe abdominal pain, hypotension, delirium, acidosis, and coma. Formic acid has affinity for optic nerve and causes retinal damage resulting in blindness. Death is due to respiratory failure. Treatment: correction of acidosis. An acidosis has a retinal damage, therefore immediately acidosis should require correction with IV sodium bicarbonate infusion, helps in preventing blindness. For example, sodium bicarbonate infusion 3 gram per hour should be done until pH reach up to 7.5. Patient should be kept in dark room to protect the eye from light. Induction of vomiting, gastric lavage should be given, multivitamin tablet, especially vitamin B and vitamin A should be started. Ethyl alcohol is given as infusion or 25 ml per 50% 3 hourly till the acidosis is controlled. It competes with the methanol for alcohol dehydrogenase. show the metabolism of methanol and thus prevents the formation of toxic metabolism. Then fomepizole, it is 4-methylpyrazole. It is a specific antidote. It is also inhibits alcohol dehydrogenase so as to prevent formation of toxic metabolite. Then folinic acid, it may protect ocular toxicity by inhibiting ocular toxicity by increasing format metabolism. BP and ventilation should be maintained, means positive pressure ventilation, and diuretic uh, dialysis equipment and supportive measurement is also needed during all these procedures. Thank you.